Welcome into To Your Health. We had an amazing doctor last week, Dr. Pierce, from the Geriatric Behavioral Center in Prattville, that the Baptist Health System has just opened this because they saw a need and they have filled it. And today, Kristie Watt, we have you with us, and you're doing more of you're going to let everybody know what the purpose of this is, how to use it, and really help us. And there are loads of things that you need to know out there. So let's start out with, suppose that I maybe I don't have somebody exactly in a crisis, but I've got some problems with somebody who is elderly, and maybe depression, maybe Alzheimer's, could be a number of different things. Tell me how we go about learning about this place.
Great. Well, you could call our Prattville number and ask for the Behavioral Health Unit. We have a licensed master's prepared social worker who will be glad to help you with any needs that you may have. It may be as simple as going to your local physician and talking with him about it. That's always a great place to start because most of our geriatric patients have been with their physicians for 30, 40, 50 years. And he is welcome to make a referral to our unit if he sees that need. Also, if someone is in crisis or maybe you just don't know what else to do, you can go straight to one of our Baptist ERs and you can be referred from there as well.
Okay. And then as far as like getting the word out in our community, because it is new, this is something new, and this is something we have available that we have not had before, that is tremendously needed. And tell me the things that you do to let people know how to make this work for them.
I go out and speak to the community, any civic organizations, study clubs, whether it be a men's prayer breakfast. Wherever I'm asked to speak, I will gladly speak because we all know someone who has been affected, someone who's aged, someone who has Alzheimer's or another form of dementia, someone who needs those medical services, and we typically find out that they need these when we're in a crisis. We don't just go through the phone book and go, well, I think I need some help today. The crisis comes on and then we're forced to learn quite quickly.
Yes, yes.
And our unit wants to be that resource for the community, for the surrounding areas. We want to be your go-to people, whether it's maybe walking you through the disease, finding a support group. We help find meals. We help find other medical services, housing services. There's a lot of services that are available just in the Tri-County area that people are not aware of. So we want to become your resource, not only to help your loved one get better, but to make sure that they do stay better.
So if I'm understanding this correctly, if they get in touch with you at the behavioral unit, Geriatric Behavioral Unit, then you can lead them to social services,
yes, ma'am,
to getting food, to all kinds of things. So it doesn't have to be just some medical situation. Is that correct?
It does not have to be just some medical situation, because part of our ministry is to make sure that our people can be happy and healthy wherever they are. And if we have the resources to help just one person, then that's what we want to do.
Well, I just think that please listen up, because there are a lot of clubs out there that would love to have you, I'm sure, come and speak to them, because this is a resource we've not had before. This is something new, and we need to get that word out for the geriatric patients who do. Like McCoa would be prime for that. And they can help provide meals as well.
Absolutely.
I think that what I would really like to get across is that there is not just medical, there is also social help available here.
Correct.
Now, let me ask you this. Let's say there's someone in our audience who really needs your services. Tell me the best way for them to actually get to you. Do they need a referral? Can they just call?
For patient services, most are going to be admitted directly from an emergency room.
Okay.
So if you're in need of the medical services, please go directly to one of our Baptist emergency rooms.
Okay.
Or you If you're not in need of medical services, if you need the education or if you need the resources, then please call me at the Prattville Baptist Behavioral Health Unit, and I will be glad to assist you with that. And if I can't help, we will get you to someone who certainly can.
Folks, you don't have to be miserable, and you don't have to leave this earth. There is help for you. And Kristie, thank you so much for being with us. And folks, give us a call if you need to know anything. Give Kristie a call, and thank you so much for being with us. And we'll be right back.